The benefit of coming to our center is that, first of all, we're a very large center with a lot of experience taking care of patients that are very complex. So if you happen to be someone with organ failure, but you also have heart disease, or you have some lung disease, or you have some other complex surgery that you've had before, etc., the advantage of coming here is that we are very experienced with these multiple types of complex issues. The second thing I think is there are a lot of experts here, multidisciplinary medical physicians who help us with our patients throughout the surgery, so there are a lot of consultants available either during the surgery and even after the surgery to help the patient get through in the most successful way. The other thing is the Ohio State Medical Center is an academic center, so there's a lot of research going on. And transplant is a great area for research. We have research going on in terms of how to convey the information to our patients in the best way so people really understand what it is they need to do to be healthy after transplant. So that would be education research and transplantation. There are others who do research that are related to transplant ethics. My particular area of research is actually associated with immunology. So one of the problems that transplant patients face is immune damage of the kidney, especially antibody immune damage, which is an area that is something we don't know as much about right now, and so that's why that's the focus in my laboratory. We have patients who develop antibody-mediated rejection, and there are things that we can do to treat it, but we haven't come up as a field with the best treatment regimen for antibody-mediated damage to the organ. And so for that reason, my laboratory and my team is working on understanding, first of all, how do antibodies damage the organ, and second of all, how the immune system regulates the production of antibody after transplant. How is that regulated? How is it affected by the immunosuppressive medications we use to suppress rejection in the first place? And we've found some very exciting results in terms of some normal antibody CD8 T cells that suppress the production of antibody, and we're focused on understanding those cells and how they work better so we can help reduce the amount of antibodies that are produced after transplant so the organ can continue to work without failing over time.